Falls present a serious health risk. The National Safety Council says falls are the third leading cause on unintentional injury-related deaths. Joining us now for National Falls Prevention Awareness Week, we have Dr. Jennifer Donahue, a family medicine physician with Pro Health Physicians in Groton. It's great to have you with us, Dr. Donahue. The statistics are rather sobering. One in four
elderly
people
adults
65 years and older will fall
each year.
And what are some of the risk factors for that?
So there are a lot of things that can play into this, but one thing is as people get older and they have an acute or a chronic illness, they can get put on medications. Medications can make them more likely to fall. They can have problems with their balance or their strength. They can sometimes have vision issues that'll make it hard for them to see.
And what are ways we can actually prevent this from happening? There are ways we can do this. We can strengthen certain things. What can we do?
You're right. It's really important for us to identify those things and work on them. So in my Pro Health office, we work a lot on home safety and then also on things like exercise. So if you can be active with some sort of a strengthening or balance building program like Tai Chi or yoga, that can have a huge impact on your risk of fall. And then home safety, that's one of the biggest areas we can hit. We want people to make sure their stairs are clear of clutter, that there's a good railing to hold on to on both sides. We want to make sure there's grab bars near their toilet or their shower or their tub or even doorways to make sure they don't fall.
And you can also get rid of area rugs as well, because
Absolutely.
I think that causes some folks to trip and fall.
They do, a slippery floor, so area rugs often will slip, or sometimes the floor of your tub or shower can be really slippery as well.
For some people, there's that fear of falling that actually creates some anxiety.
And it increases the risk of falling, unfortunately.
It does, okay.
Yeah, so people who are afraid to fall, they'll often decrease their activity level, they'll do less, and over time their muscles get less strong. So as a result of that, they're weaker and they're at higher risk for fall and injury.
So what's actually happening when you're falling?
So when you're falling, it can be from a lot of different things. So sometimes there's a hazard or some sort of an obstacle that you haven't seen. Sometimes it's an issue with just your own strength or your own balance just getting in the way.
And what kind of injuries are a result because of falling? I mean, I know there are many. What's the most prevalent? What's most concerning?
So many people will have just lacerations that need to be stitched, but more concerning are fractured bones, especially your wrist or your hip, your arm, or we can have pretty serious head injuries. In particular, people who are on blood thinners can get very seriously injured with a head injury.
So what should people do when they do fall? What's your advice?
So when an elderly person
Especially
falls,
an elderly person, yes.
If they've hit in their head, they should see their doctor, or if they seem to have any other significant injury. But another thing we want people to do is be proactive and talk to their doctors about a customized fall prevention program for them.
Oh, what do you mean by that? Is to actually design a program to help them from
to look at their
prevention and treatment, etc.?
Yeah, to look at their own home safety, to kind of see what needs to change in their home, to see how they need to adjust their exercise, to look at their vision. So a lot of the time people have difficulty with vision, and sometimes even with people's glasses, if they have progressive lenses or bifocals, when they look down they can't see very well. So if that's the case, making sure you have just glasses that correct for distance for walking.
So basically a checklist.
Yeah, go through it. Your medicines, look at your medicines, talk about them with your doctor.
Perfect. Dr. Donahue, thank you so much. A lot of great advice there.
Thanks for having me.
You're welcome. All right.